Good afternoon. My name is Hallie Bynum. I'm a junior at Fitzgerald High School, and I'm going to be presenting my final project. So for this project, I got to shadow a group of surgeons at Dormany Medical Center, and I did this because I wanted to explore more about what I wanted to be when I grow up. And so I've always known I've wanted to be a part of the healthcare field. I just never knew in what way. I didn't know if I wanted to be an RN or if I wanted to be a dentist or a physical therapist. I honestly had no idea. So I really pushed myself out there on this one, and I went and explored the surgical aspect of the healthcare field. So again, I shadowed surgeons at Dormany Medical Center for 3 days. I arrived around 7 a.m. each morning, and I stayed until 11 or 11:30, depending on what types of surgeries they had and how long each surgery took. So I was surrounded by a team of medical professionals, each one having a different job. The one I learned the most from is the general surgeon, which is Dr. Herring right here. I also learned from a nurse anesthetist, which puts the patients to sleep during surgery. And I also learned from a group of RNs. These were the nurses that were handing the tools back and forth to the doctors and the surgeons. These were the nurses helping the patients go into surgery and helping them after surgery. I also got to experience the new equipment, so it was more than just me learning about what the people do, is about what the equipment does also. So I got to see new cameras and new technologies that I didn't even know existed. I also learned more about PPE, which is personal protective equipment. I got to better understand how clean things have to be and how I can't stand in certain areas, and the gloves I have to wear, the shoe covers, the mask, the face shield, the gown, everything that you need for surgery I had on. And I also got to really understand how things are applied in the real world. So I have been taking healthcare classes, and I learned information in the textbooks and I took the test, but I never really got to understand how it works out in the real world. So I took that information I learned and I got to see how it's applied and how it's used to actually treat patients. So beginning with, I want to do a surgeon overview. So basically, all surgeons have different specialties. They all do different things, but the one thing they have in common is that they operate on the patients counseled by other doctors and physicians. So these surgeons aren't the people that are diagnosing the issues, they are the ones operating on it. And yes, they may discover issues while they are in surgery, but they are there to correct the problems. I also researched the education required. And so, one thing they have to do to begin with is 4 years of undergrad. For me, I'm hoping that will be the University of Georgia, where I will do 4 years. And after my 4 years, I will have to take the MCAT test, which will allow me to get into medical school. There, I will do 4 years of medical school, and I will obtain my MD or OD. The MD is a medical doctor who really just works on the issues. The OD is their qualifications are the same. They just really go further and investigate the problems and really research, okay, what could be the problem of this and why is it happening and how else can I fix this? They have the same qualifications. They are trained the same. They know the same information. The OD just goes further. After that, I will have to go to a residency, and my years in my residency will vary depending on what specialty I choose. So if I choose to be a dentist, I will have to go to less years of residency than if I chose to go be a neurosurgeon. It really depends on what I want to be when I get there. After this, I will do a specialty fellowship. So my salary on entry level or the lowest paying surgeons start out around $250,000 a year. The average paid surgeons are start out around $500,000 annually, and the higher paid surgeons, which is usually the neurosurgeons and the heart surgeons, they go around $800,000 annually. So then I researched types of surgeons because I honestly have no idea what I want to be. And I want to be a surgeon, but I'm not sure what type. So the most basic surgeon is your general surgeon. They operate on common issues and procedures. So if somebody needed their gallbladder removed, which I did get to see, they would go to a general surgeon. If you need a colonoscopy done, you would go to a general surgeon. There's also neurosurgeons, which operate on your brain, spinal cord, and other nerves. So if someone was having trouble walking because of a spinal issue, you would go to a neurosurgeon. There's also an orthopedic surgeon, which I also got to see while I was there shadowing. They operate on your muscles and bones, so if you were having skeletal problems, you would go to an orthopedic surgeon. I also got to see a cardiothoracic surgeon, which operates on your heart and lung, your chest area. So if someone was having problems breathing, or if they had a heart attack and had a blockage in their heart, then this is the surgeon they would go to get those problems corrected. There's also an oral surgeon, which operates on your jaws and your teeth and your mouth. All this area right here is your oral surgeon. I've actually been in one of these before when I got my wisdom teeth removed, but also patients who have trouble eating because of jaw issues may go to the surgeon to get their problems corrected. There's also plastic surgeons, which do skin enhancement and repair. So a burn victim may have to go to a plastic surgeon, or if a woman wants to get her skin enhanced in any type of way, they can also go to a plastic surgeon. Lastly, there's a trauma surgeon, and these surgeons are ER based and they work in the emergency room. Next, I listed the places that I could work once I become a surgeon. So if I wanted to work in a hospital, I would most likely be a trauma surgeon. There I would be based in the ER and I would do surgeries on anyone who needed emergency surgery. There's also private practices, which is mainly your oral surgeons. So I would work for myself. I would employ other RNs and nurses to help me do my job. I would pay them. You just really work for yourself on that one. With group practices, you go in to a partnership with other surgeons. And then there's physician's offices, which could be like an OBGYN or a general surgeon. Next, I'm going to talk about the types of surgeries I saw. So I saw 2 colonoscopies, a knee scope, an abscess removal, a gallbladder removal, and a tubule ligation. And in this picture, I am about to see an abscess removal. That one did not interest me. I almost passed out on that one. So I know I do not want to be a skin doctor. So my most favorite experience was definitely the gallbladder removal. This picture is the gallbladder they removed that I got to watch. I really enjoyed seeing the new technologies and the cameras and how everything really comes together with the technology aspect. I got to see some basic techniques that I didn't think they even used. So the patient I thought was going to lay flat on the table like every other surgery. For this one, they just turned the patient slightly on her side to open up her chest cavity, which is where your gallbladder is located. And they got a better view of the gallbladder. It was just something so basic I didn't even think of. Also, there was an incredible process. So for this one, they cut the patient with an incision about this small around the chest area. They stuck a tube in her body, a metal tube. They stuck a camera down in there, equipped with so many different tools and things to get out the gallbladder. They cut around it. They cut out the connective tissue and the fatty tissue holding the gallbladder in place. They also then put a bag down in that tube, put the gallbladder in the bag, sealed the bag, and then pulled the bag out of the tube. So I didn't even think this was a thing. I didn't realize why it was necessary, but it was definitely a cool process. Then they closed off all the blood vessels, making sure she doesn't have any internal bleeding after the surgery is over. And one of the coolest things is the patient is not going to have any large scars. At most, there will be a minimal scar about this long, which is really good for the patient. The most interesting procedure that I saw was the colonoscopy, which is where they stuck a tube into the rectum and then to the large intestine, poured it back out slowly to make sure there is no abscesses or any kind of growth going on in the large intestine. And this goes for older adults, starting around age 50. So for this one, I researched further and I made a brochure to go along with the colonoscopies. This is a quick guide. It has everything needed for a colonoscopy that a patient may need to know. So I really went through and I described what a colonoscopy is. And again, that's where they stick a pipe with a camera on it into the rectum around all the way to the small intestine. Right when they reach the small intestine, they pull it back out the large intestine slowly to look for abscesses or polyps. And usually if there's a polyp, it may be cancerous. So that is why they're doing it. They're preventing cancer. Also research the preparation, which includes a diet of clear liquids. So if you fill your body with foods before the surgery, your intestines will be backed up with solid foods, allowing the surgeons not to be able to see anything that you have in your body. So they couldn't even see the polyps if you had one. So you have to fill your body with clear liquids so they can see what's going on inside. I also talked about why the patient may need this procedure. So doctors recommend it starting around age 50, just because of old age. They want to prevent the cancer that could be there. If you have family problems, they may recommend you get one starting around age 40. It really depends on if you have a family history, anything going on, or if you have unsolved medical problems going on with your gastrointestinal tract. So after the procedure, you can go home, and within 24 hours, you can go back to work. You wake up an hour after you have the procedure, and the doctor will get the results back to you. The polyps that you may have are sent off for a biopsy to determine if they're cancerous or not. If they're not, you're fine for another 10 years. If so, the doctor will consult you after that. And so again, this is just a little pamphlet for patients, like a quick guide for them to get any quick information they may need. Also, this is my works cited. It has everything where I got my information that I researched about. And I just want to say thank you to my instructor, which was Lynn Marsh. She helped set this up for me and really provided me with a great experience. Thank you.